Morning, everybody. I am just promoting everyone to panelists.
Now I got it.
Hey. Good morning. Sorry, we're just playing a little bit with the sound here. Good morning. Hi, Ed. How are you? Thanks for your message. Reminding me that I hadn't put the link in the the link itself right in the message. So good.
Okay.
Good morning. Okay, so I'm just going to promote folks to panelists as they join. Oops. Morning. Okay. Looks like Daryl is rejoining. Okay, now funny. Oh, okay. There's Kay. I'm just checking my attendees versus my sorry. I'm managing the I'm sorry. I am managing the changing, we're in webinar, so I have to bump people from just getting to watch me talk to being panelists. And so that means I'm kind of watching the waiting room. So apologize for being a little distracted. Good morning. I'm just gonna wait. Let's see, we've got all 4 communities. I know Jason Belmonte was joining, and so was Tim. So maybe we'll just give them a minute before we get started. Brenda, it's nice to see you. Welcome back. You're muted. You're muted.
So this is Daryl. Sorry I was late. I was on a call with DEP and just had to
You're
get
fine. You're fine, Daryl. You were late for watching me, let people promote people out of the waiting room and
okay.
a little sound check stuff. So you are absolutely fine. Thanks for letting us know. Brenda, you're back in action.
I'm back in action. I'm hanging in there.
I'm glad. Welcome back.
Thank you. It's been good to be back. I was bored.
I bet you were. You're a busy lady,
was.
so
I was bored.
to be to not have the same kind of action going on probably was a little disorienting. So,
And the hardest part was not being able to talk. You know me.
yeah. Be like me not being able to talk. That would be hard. Be very hard. So, okay. All righty. So, okay, so we do have a quorum. However, we are actually not posted fully. We can meet. I checked with, I got advice from council that, and I'll explain why, but so we're not voting on anything. That's why you didn't get minutes to review. Because I didn't want anybody to even think about that. So this is a non-voting sort of non-formal meeting. The reason is that when we were sending the email to the different communities to have the meeting posted, there was some sort of technical issue happening in Sherborne, and the message got bounced back by the server, and we tried a few different times. It just didn't work. So again, spoke with council and they said, you know, because there was an effort made and it was a technical glitch and because, and as long as we don't vote, that we can continue to meet. So I am gonna be a little cautious with us and I may direct conversation a little bit because technically we're not supposed to talk about things that we may deliberate on later. So we'll keep it to kind of a business meeting. And if folks have questions that might put us into deliberation, perhaps you could write them down and email them to me and I'll make sure that we pick them up in our February 15th meeting, which will be properly posted. Okay, does that
As
make sense?
the Sherborne rep, let me just ask so that that doesn't happen again. I don't know what mailbox or whatever that message
we-
might have been going to, but does somebody know in Sherborne about that so we can have the IT folks look at it?
So we did send subsequent messages that didn't get bounced back. So it was really a timing issue, Daryl, and not a,
Okay.
you know, it was just, we didn't get it rectified in time for our posting deadline. We
Oh,
needed
Lord.
to be posted by 9 AM on Thursday to meet the requirements. So, yeah, it was a temporary
okay.
timing issue. So all fixed. Okay, so there are no members of the public present. I guess let's just do a quick, I'll just do a quick introduction. Rebecca Queenie is joining us today. Rebecca has just recently been hired to be one of the 2 trainers for the training hub that is also part of the Needham department's work. And Charles River is one of the 5 shared services arrangements that Rebecca and Sam will be doing the training with. So I wanted Rebecca to have an opportunity to just kind of meet folks and see the things that the advisory boards and that are discussing as we do our business. Oh, and I see a hand raised. I think I see a hand raised. Right, okay, so, and, Jeremy, yeah, Jeremy is asking a question in the chat about the meeting posting glitch. So the message was sent to both the agenda posting email box and to the town clerk email address. And both of those bounced back multiple times. So, we don't know if it was a server issue between, you know, if it was just a Needham to Sherborne issue, we don't know. We don't know more. So, okay. Brenda, did you have a question?
You, and I,
Brenda, you're muted.
okay, I should be okay now. One of the things I was gonna ask you to do at some point during the meeting was you sent me 4 criteria. Because all the time, people are saying, oh, why can't we get the money from shared services? Why can't we get this? And you sent me a list of 4 criteria.
Yep.
And then reference to you know, what is approved and what isn't. I couldn't find that reference, but I think that would be very helpful for people to have, because I'm being asked, you know, like from outreach for mental health money, why can't we get it from shared services? And then I had that 4 criteria to explain all 4 towns have to benefit from this and use it. And it was easy for me to go back to my community and not have to text you all the time. So we have
Right.
this, and we have that.
Right, sure, yeah, that's a list that is pulled from it's from both the MOU and from the requirements for the funding from the state. So, yeah, happy to share that and happy to say it. And I know I'm coming to the Medfield Board of Health tomorrow night, and I will include that as part of my information. But yeah, I mean, and that's just what Brenda's referring to is just kind of the basic understanding that we have of that monies are spent, you know, the advisory board considers the monies are spent, they're supposed to benefit all of the communities. And so then there are conversations, for example, the Dover and Sherborne nursing arrangement, the body agreed that that spending some of the dollars to support that nursing presence in Sherborne was a valuable thing for all of the communities in the arrangement. So it's a rule with some space for doing something that would clearly, you know, that clearly is benefiting in the spirit of this idea of sharing services and expanding public health capabilities. So yeah, I'm happy to share that. Hi, good morning, Jason. Good morning, Tim. Okay, so as I mentioned to folks, so this is not a formal business meeting. We're not posted, but we can review items, and we do have a presentation scheduled from Relevant Technology, Relevant Systems, apologies. They will be coming to do a demonstration of the Food Co Pro system and will be available to answer questions from you all. They had a prior obligation and should be arriving sometime between 10 and 10:15. She had a meeting that ran exactly till 10. So, but Diane Legere from Relevant Systems will be joining to show us, show all of you at your request, show all of you that system and talk a little bit about how it works. And that is one of the systems that we use the shared services dollars to fund. Daryl, you have a question?
So two things. I'm just off screen because again, my computer connectivity is not so great, whatever's going on here. The other thing is we recently had our first chance to view food inspection establishment report out of the Relevant system, and it was very nice.
Good.
The embedding of the photos in with the findings was really wonderful. So
Yeah,
thank you.
good. I'm glad to hear that. Yeah, it's a pretty powerful tool. It's been really interesting to hear folks. I've gotten to sit in on a couple meetings here in Needham with inspectors from Needham, and then of course with the regional inspector, talking about how to use it. And it's a pretty powerful tool. It's exciting to see. Okay. So, so as I said, no review of minutes because we're not voting today. You'll see, two sets of, you'll see notes from this meeting and you'll see a set of minutes at that February 15th meeting, and, we'll vote to approve then. For the IMA, I just want to update you on our progress. I did, sorry, just thinking. So our next step after our meeting was to share with town council in Needham, and did so, provided some background information with them. Had two brief meetings with them, and Tim McDonald also spoke with them because it is Needham Town Council. So Needham as the lead community, they're the ones that get first crack at the agreement. And my job is to represent the shared services program and explain what the goals of the program are. And Tim's job is to explain Needham's, you know, perspective and objectives and the like. So we met with Chris Heap, and he gave us back some comments. So Tim and I are going to meet about those this afternoon. Just got the comments back on Thursday, I think. Tim and I are going to meet about them this afternoon. I anticipate that there should be a draft out before our next meeting that will go to the other three communities. And at that point, it's up to the other three communities council to review and consider the interests of each of you, just like Needham is doing. And and review and then identify any issues. And what I talked about with council from Needham was possibly arranging a meeting of all of the council for all 4 communities together. That'll kind of depend upon what the outcomes of review are. If there are policy questions, it might not be productive, but if there are issues of language and the like, then we'll do that. So new target is distributed before February 15th. And I'm gonna be generous and say that I hope that we can get this done by the end of March. Maybe we can get it done sooner. We may be able to have it signed by chairs of the Board of Health and chair and select board, as opposed to having to have it on the agenda as a vote. You know, there are some of those things that might work in our favor to move it more quickly. So that is my process update. Does anybody have any questions about that? Did I leave anything out? Tim, was there anything, sorry, before I hop to Tim, was there anything you wanted to add from the Needham perspective in the meetings?
No, I think it's something we've probably said before, which is, you know, Needham sort of has 2 roles. It's one of the 4 equal partners in the shared service agreement, but it does have a role where it's exposed to greater liability by virtue of holding the money and hiring some of the staff. So we are trying to just balance having an arrangement that works well for all 4 communities with one that doesn't expose Needham to too much in the way of extra liability. We'll have all the staff and all the hiring, all the money. All the
Thanks,
modifying
Tim.
things if we screw things up.
Yeah, I thought town council from Needham was, he asked great questions. It was very perceptive. I thought it was a very productive meeting. So hopefully we'll work through. And I saw Carol and Jason had hands up. How can I help you, Carol?
Hi, thank you. Very quickly. Can you just reiterate? So when Needham is finished, then the other towns get the agreement? Okay. It was really powerful to have Mike and the gentleman from KP on the meeting last time and support what's going on across the Commonwealth with these agreements. And I feel like with my town, and Kathy and Brenda can certainly add their perspective, that knowing that, you know, this agreement is a standard type of agreement that is connected to the gift of these services, I feel is important. And having their voices, I know our town attorney has been many years and used to KP Law. So just want, as an advocate and a 32-year resident, to be able to know the time frame and to support when that's happening and be able to advocate.
Yep.
So I appreciate you keeping us in the loop with the timing of when that's going to drop for attention.
And thanks for, I'll give a little more clarity on how that will come to you, right? I'm not just gonna forward an attachment, and I realize I should have said that. I will send a formal note to each member of the advisory board that describes the agreement, that describes the source of the funding for it, that describes the relationship with MAHB for technical assistance, and explains the review process to date. And I will in it explain that it needs to be reviewed by town council. I certainly can't send an email to your town council, but I'll put the note in that says, please share this with your town council. In addition, with the access to MAHB, I can include Rich Mucci, who is the attorney that you're referencing. He's actually, he I think has done a fair amount of work with KP Law, but he is not of KP Law. He is solo. So just
Sorry.
No, you're fine. Just to save you any trouble down the road. But Rich is available. He's available for any of the lawyers to reach out to at any point. So I'll include that information as well. And I'll do everything I can to make it as kind of wrap it up in a little bow and send it along, and then whatever questions you all have, whatever questions you run into, you can just get me however you want to. And I'm sorry, so I see Kay has her hand up, and I thought Jason had a question too. I'm guessing you guys probably maybe have the same questions.
No, I actually didn't have anything. If my hand was up, it was an
It
accident.
was, sorry. Um, thanks, Jason. Morning, Kay.
Hi, my question is really for Carol. I think you said that that Mike and Rich Mucci or one of the other of them was at a meeting. I'm wondering strategically, did you invite them to a meeting with your town council? Is that,
I was able to hear them at the meeting Carrie had
I see.
for us. I've
Okay.
also, I listened to the Office of Local and Regional Health webinars once a month, and Sam Wong does a really great job. Cheryl's on those, and often there might be points of clarity or presentations about
Mm.
the benefits of shared services. But no, in particular, it was it the December meeting?
was.
I think
Thank
so,
you.
yeah. Okay, thank you.
Yeah, I mean, and well, I think, I know Rich, who you all had the opportunity to meet. Rich is happy to join a meeting if you want to ask for a meeting with town council, or if you want to ask them to come, they would, Rich and I could come together. So I think that is easy to accomplish for any of you, and everybody does need to think about how they want to approach this. And I don't, right, so, okay. And I was invited to Medfield Board of Health for tomorrow night they asked me some questions, some kind of follow-up questions about inspection and the like. I had attended one of their meetings, as I've attended all the others. And they asked if I could come back. So I am doing that, and I'll come back to any of you anytime. I do have all your meetings on the calendar, and try and make plans to at least what we call lurk, right, and be present, so that if I can hear it, and if there's anything, I'm available for you to text or however you want to proceed.
Carrie,
Yes,
I
ma'am.
know we've said this and said it on our Zooms. It's incredibly valuable to have you there, to be willing to step in, to answer questions, to clarify on myriad different things that come up. So we really, I kind of see this almost as a mentor role too, with all your vast experience. So thank you for joining those every month. It's huge. I know Kathy and I've talked about it, and
I'm glad, because
Me
that's
too.
thank you for saying that, Carol. I'm glad to hear that. But I mean, I don't want to do something that's not useful. That's always my intent. But and I do love talking about this stuff, and helping y'all figure out the questions, and give you the information that I have of how the state is envisioning this and so forth. So yeah. Okay. Any other questions on IMA? If not, I will move us on, and I'll just talk. So there are a couple of items that you all have, we've talked about, and I can just give you a status update on it. So Office of Local and Regional Health, who are the funders, and they're the ones that have to approve our work plan, have to approve our budget. And Tobacco Collaborative was one of the things that was on our work plan as a question for us. It was a consider this. The town should meet and consider whether they want to do some kind of collaborative tobacco inspection activity. And let's see, we reviewed, we had the subject matter expert from the state reviewed the tobacco policies that the town of Needham used, because they were identified as a good starting point. Those were reviewed, some changes were recommended. Needham is working through those changes. I just asked the agent about that, and they are cataloging, and I think that has to go to the Needham board. As soon as I hear from Needham that the that the changes, whatever their standing is on the changes, once that's done, then I'll share the procedures with each of you, and you guys can have a look at it as well. And then what I'd like to do, if folks are interested, is then what we'd invite Needham and a subject matter expert from the state to come and talk about how that program runs, and lead y'all in a discussion of what's beneficial to you, what isn't, and then that'll satisfy one of those work requirements. So I am thinking that is for our March agenda. Does that make sense to folks? Do we any questions about that particular item? Nothing. Okay, thanks. Then there was the question of medical director, and there's been a lot going on. Kelly Boudreau actually helped me out some, the regional public health nurse, doing some research. We're trying to identify the standards by which medical directors get acquired, and there's a lot of info out there, but it's not quite as simple as we hoped. So, and when I put the request into DPH, they asked for information about the role, about the description of the activities, about the costs and the like. So Kelly was helping me pull together some information. We have that, and I'll share it with our project officer from DPH and see what more they say. I think we kind of are doing this tension of, we want to do this thing, and shared services folks at DPH want to support activities, but it needs to fit into, needs to be an identified need. And right now they're saying, is it in the capacity assessment? Is it part of your work plan? It's just a matter of figuring out how to fit it in. So, there has been a lot of effort, and I wish we had more progress, but we're getting there. I am going to be scheduling the Office of Local and Regional Health asked for, we have a new project officer, and they are looking to schedule a quarterly meeting to review the quarterly report and budget and the like, and anyone from any of the communities is welcome to attend. So I will send out note about that and see what we can work so that people can attend. And I'll share notes from it so that if it's not a convenient time. Daryl and Kay, and I'm sorry I missed who was first.
So on the medical officer, would it be helpful to have statements from Sherborne and the other towns about the difficulty of arranging that?
Actually, if you could
That's awesome.
document sort of the barriers, that would definitely be useful.
I mean, it's a small but very important part. We can't get the
100%.
benefits without that.
Yes, absolutely. Yeah, if you could, if you could list out the barriers, that would be really useful. And I think one of our first meetings, Mike Hugo from MAHB was like, "Oh yeah, people, other groups have funded this activity." So it's not that we can't do it; it's just figuring out the mechanics of it. It turns out to be a little bit more complex. I think a lot of communities, have a physician on their board who is willing to, do that. And when it gets beyond that, it gets a little less clear. So, Kay. I'm sorry, Kay, you're muted.
Should we send those comments to you?
That would be great.
All right. So
I
I
mean,
guess I would like to hear a little more specifically why there's reluctance to pursue this, because I have to say that every nurse has to have somebody who assigns standing orders. There has to be a physician signature, I think, when you order vaccines. And is it only if why is this not recognized as a universal need that, fortunately for some communities, is filled by a board member who happens to be willing to do this, but, and I would also say by a board member who isn't probably vetted, the way you would somebody you hired in a formal process. Why is this an issue?
So I think perhaps I wasn't properly clear in my language. The issue is not that it's not something to be taken care of. The issue is that they want some details, specific details of what is the job description, what will the cost be, how are the services going to be delivered? And, you know, it's absolutely recognized that folks need a medical director. It's just I can't just send a note to the state and say, we need a medical director and we think it's going to cost $500. They need documentation of it. And as it turns out, what we've learned so far, and Kelly can chime in and correct me, but what we've learned is that it's that it is a challenge in other communities, right? And there's not a clearly worked out process. It is one of those things that 351 towns have figured out 351 different ways to do. So we're in a developing area, is I guess how I'll characterize it. Does that help, Kay?
Somewhat, yes. Do you think that, so this is going to require some sort of a market analysis about what communities are paying for this, because I have no idea what it's going to take for us to hire somebody. And is that something that the shared services program could help us do?
So that's when I was saying that Kelly had been doing some work researching. That's exactly what she was doing. Kelly Boudreau, the regional public health nurse, I used some of her time to send out inquiries to the Public Health Nursing Network and Community Network to get information on how communities arrange for their medical director and what the costs are and if there is any job descriptions. So that's exactly what I was doing to help forward us.
So, so you don't need us then to send you a sample job description and
No.
a salary range.
No,
What is it that you want people in Dover and Sherburne to send you then?
Daryl, I think, had offered if there were information about the barriers to this, why this was complicated, and that's helpful. Yeah.
I was thinking we could also send you what level of effort we would anticipate for Sherborne. Although, since we've always contracted out with VNA services in the past, figuring that out might be a little tougher. But I think what I envision is the hardest thing, which is why a lot of our board members or other residents of the community who are doctors have not been willing to do this all the time is because of liability, and their employers are unwilling to take that on behalf of the town. So that, to me, seems to be the biggest hurdle.
Yeah, I think I agree, and I think that, as I said, we're kind of discovering that there's this everybody's kind of figured it out. And to that point, I think the specific answer of how the community has functioned prior, without, what in what way did you get orders signed off, or, under what auspices were you operating? Did you rely on VNA to do your ordering, or did you rely on another community to do the ordering? I think that information will be helpful for this. And what we're doing is we are sort of ripening the policy issue for the state. We're identifying all of the different places and ways that it's happened, and inadvertently we're doing that just so that we can get an okay for ours. It's not going to be hard. They just need to know that due diligence has been done, and that's what we have been working to do.
I mean, to Daryl's point, Needham looked into this a few years ago.
I'm sorry, Tim, can you speak up a little bit? Thanks.
Sure. Sorry. To Daryl's point, Needham looked into this a few years ago, and we've historically had one of the emergency department physicians that will sit on our board as the person who signs off on medical orders and on things like that.
Yeah, your mic is going in and out, I think, Tim.
Okay. let me type it in the chat.
Okay. It's so funny, cause it's crystal clear, Tim, and then it kind of fades out. I'm not sure why. Yeah, sorry. Okay.
So it sounds like this might be more complicated for whatever reason. I mean, I don't know. It's a fairly straightforward issue, but maybe the answer to it is not. So in terms of timing, we should be scrambling to find a way to get the vaccines that we need to order very, very soon. Is that, am I reading that right?
So, so, um, so one of the requirements for ordering the vaccine, so does Sherburne have an active MIIS account right now? Have you all ordered vaccine before?
Yes.
Okay, and
And
okay.
here we've had different doctors, but some of them are no longer available. And
Okay.
they really do it quite reluctantly, but because we have no other option, and we're not keen on pushing people to that.
Understood. So I have explored a little bit with, talk to the Needham, the public health nurse. I'm gonna say leader, but that probably is the wrong title. And to ask, and it may be possible to order a vaccine that Needham could order the vaccine and disperse to the community. So I've been working to identify what are the workarounds, in the absence of a medical director online for the communities.
That sounds great if that
Yeah.
can happen.
Yeah,
Thank-
trying to work all the angles. So I'm quiet, but I'm busy. So Kay, sorry, Kay. Yeah.
It's for Tim, it's sobering to read what you said in the chat. What was your solution?
Our solution was that, can people hear me?
Yeah,
Yes.
perfectly now.
Our solution was that we ran into a roadblock and we tried to go around it one or two different ways, and then we couldn't find a way around and things got busy. So we stayed with our status quo, which is that Stephen Epstein, who's been on our board for, Ed could tell me, but I think 15 years or more. Ed probably still thinks of him as a newcomer. But he's been the one who signed off on our orders. The idea of a separate medical director that's paid for us is attractive because in theory, we have a 5-member board. In theory, say 4 of the board members wanted to do something, but Dr. Epstein didn't. Well, that would be a problem because the board as a whole had decided it wanted to do this and the public health division was going to try to make it happen, but he would essentially get a veto. So we had, and this has never actually come up. This is sort of a philosophical governance question, but if one board member can sort of veto the decisions of the other 4, at least in the context of immunizations, it's a challenge. We just weren't able to find someone who's knowledgeable about public health, like I said, and interested to, take on work that probably doesn't pay well and to take on the liability for a relatively modest cost, right? We sort of need someone who's like a public health fan that wants to get involved and this is their way to dip their toe in or something. Because it's certainly going to be costing them money essentially to spend their time with us compared to what they could make.
And I think I know Steve Epstein. Is he an ED doc at BIDMC?
Yeah, he's around the entire BI system, I think.
Yeah, and he's wonderful. Is he? Does BIDMC cover his liability for this then? Because that's been that was the issue in Sherburne was that I think MGB wouldn't cover the liability for your physicians, right? Who are on the board, Daryl? So maybe
Our understanding was that BID Needham, because we have BID Needham and Needham, and because Dr. Epstein occasionally practices there, we're willing to take it on. A BID doctor is also the medical director for Needham's fire and EMS service. We hadn't gone that far down that road, but there was some idea of like, could that person work? There's also the school physician. He used to be a member of our board of health. Could he be one who does it? So there are options that we had sort of started to get into, but we hit a couple roadblocks and unfortunately there's a lot to do and we never quite picked it back up. But it seems like an opportune time, especially if it can help solve a problem for 4 different communities.
So so we've done the info gathering, we're doing our due diligence to pull it together. And, as I said, I didn't mean to characterize OLRH as being, Office of Local and Regional Health, as being reluctant. They're eager to fund things that solve problems for locals. But we do have to do some documentation and so forth. So that's what I have been, I've started some of that work, and we'll continue, and we'll get us there as quick as we can. We were talking about possibly ambulance services, and maybe an ambulance service. There might be someone who will be willing, so I'll kind of continue to explore. Other questions on medical director? Carol.
What do you do in Reading?
Ha! Oh my gosh, that's a great question. I don't know. I kind of keep my head separate. So I'm on the Board of Health in Reading, is why Carol was asking. And I will ask my director. I don't know. But we definitely order vaccine. So I'll find out. It
Don't feel
hasn't come
bad.
before the board.
As a former chair, I'm
Yes.
trying to remember here what we did. I thought we shifted over to our member who's a physician's assistant for vaccine. Brenda's saying no. So maybe Brenda can remind me. You're not alone, Carrie, as a board member. I'm trying to remember my own board in Medfield.
Sorry, just making a note. I'll drop a message when we finish. Although Kelly may have already asked a day, but I have to look. So, okay. All right. So again, I mean, I think I too thought that medical director was going to be a fairly straightforward kind of ask. And it was it's been a little surprising to learn about some of these complexities, but I am not one to shy away from that. So, but just so you know, so I am working it, and we'll keep you apprised. Fee review is the last thing on the OLRH list. What we had discussed was the interest and need to have information about how fees are charged in the communities, and kind of what fees are in other communities. And there was interest in that. I approached OLRH. They were willing to fund that on principle. And then when we looked at we asked someone who was doing some similar work, and their proposal exceeded the threshold. Or it wasn't even a proposal exactly, but their estimate, it exceeded the threshold for Chapter 30B for procurement. So things that are below $10,000, we can purchase somewhat more simply by just getting, requesting some quotes. Whereas if we're above 10, we do need to do a request for quotes process. So I am pulling together that documentation, and I intend to send something out and get some results for you all, so that we can see what the cost would be. That will answer your question. And it will also answer Office of Local and Regional Health question. And the goal is something that we would do, the goal is exactly what we agreed to in our previous meetings, of someone to do kind of a comparative analysis, get us some information on what the costs are, how much does it cost to do this, and have that as a tool. Daryl, you have a question?
Yeah, I was going to say, maybe there are ways to really narrow the scope to towns that have overlap with the characteristics of the 4 towns here. And that would mean not the western part of the state also. So, where costs are higher, where we've
Yes.
got similar mix of services, that kind of thing. And that might help pare back the cost. If someone thought it was a statewide thing, I could see that being a very big job.
Yeah, really good point. Yes. Yes, yeah, absolutely, because we want to do some like to like comparisons. It would not be helpful for anyone if we included, towns out in Western Mass that have different kind of costs. So thanks, Joe. Yeah, so hopefully that will proceed this week, and I'll have more information for you about that at our February meeting. And I'm sorry, did I see another question? Maybe not. Okay, so that's that. Okay. I have come and talked to each of the towns about the MAFIT rollout. Massachusetts Public Health Intensive Training for food and for housing, and the training programs that the state is working out. I know I'm coming back to Medfield tomorrow because there were some more questions about that. I wanted to see if there were questions upon reflection from other members of the board, or if they had gotten questions in their own communities. This idea of performance standards and workforce development is a little bit, well, it's new. The standards were released in October, and while they've been a long time coming, they are still new for folks. The MAFIT food training is actually the first in-person training was offered last week, I think out in Western Mass, and they anticipate offering another one in a month or two, and there'll be regular offerings of that. And the standing from the state right now is that anyone who does inspections has to complete these MAFIT trainings, with even, respecting people's experience, respecting the folks who are out in the field and doing the work all the time, and at the same time recognizing that the way that training has been done to date has been kind of peer-to-peer and catching best practices, and that there have been some changes in the specifically the food code since the adoption of the 2018 food code and nuances and the like. So they want everyone to be on the same equal footing, and that's also true for housing. So when that housing training is available later this spring, anyone who would be doing a housing inspection, it will be required to do the classroom training and then do the field training. I know some people don't love that, so I'm just going to name that, see if anyone has questions or concerns about it. Daryl.
It's amazing, tiniest town, lots of questions. Part of this is because our long-term Board of Health Administrator Director is retiring. So we're going to be posting, hopefully a month ago, for that job position, but soon. If anyone knows, maybe let them know to look for it. Is any of the training oriented towards more of the administrator director level tasks associated with the Board of Health?
So there is the
flow through, how do building inspections link up with Conservation Commission evaluations before projects pursue under the Board of Health, that kind of training, which I know they can get through MAHB and MHOA, which is what our staff usually goes to. I just didn't know if there was anything else that covered some of the nuances of Board of Health administration.
Yeah, great question. Right now, what the central trainers at Mass DPH are working on are the technical. So how to conduct a housing inspection, how to conduct a food inspection. They'll be similar for camps and the like. I think that MHOA and MAHB are probably the best bets for that kind of nuanced training. I know the foundations course is recommended for all members of boards of health, and sorry, I guess I don't know if I'll self-disclose and say, yes, I was part of the team kind of building out foundations. I think it's a great, it offers a great breadth of information. It doesn't kind of get into that, how do you operate public health within the town? I know MHOA had established there's a mentoring program that's happening. And I believe Tim is the current president of MHOA. Mr. President, is there anything that you could tell us about how new folk could learn about those nuances?
So I gotta be honest, I think this is a gap. I think it's something that we should raise to the state and also to MHOA and others. But right now, there's not really a sort of how do you financially or administratively or logistically arranged services in a health department. It's all sort of based on field personnel conducting inspections or doing services or programs. I think it's an interesting topic. I don't know that there's a lot of ground that's been broken in that area. There was a course that BU, and Carrie knows this, put on management in local public health,
Yeah.
which would cover some of the things. Unfortunately, it wasn't the type of course that it wasn't like in a webinar format. It was in person with different sort of instructors coming in. But we probably still at least have the curriculum outline. We could probably find, Carrie, maybe.
Yeah.
And it's an interesting idea because we know the public health workforce is aging, and there has been, and there's going to continue to be a lot of turnover. So it's not, it seems like an area that will continue to be a challenge.
Yeah. I wonder. Sorry, MMA just kind of popped into my head. I wonder if that would be something.
We have procedures. There are all sorts of templates for
Oh, yeah.
feed recordings, and so all of that is there. The tools are there, but I'm anticipating that it's going to be hard to fill the position, as Tim just mentioned. People are aging out, so we might be starting with someone quite new to the field. So I was just wondering if there was reinforcement. Sounds like that'll be maybe the tougher part. The technical sides of it will be easier to cover. Then will be that other side that's technical in its own right, but not in the same way.
Yep.
The food inspection is. So, all right. Thank you for filling me in though.
Well, and I think, I agree with Tim. I do think it's a gap. It's a kind of, there's lots of information of what to do, but the how is a little more elusive. And it's one of my personal missions when I'm working in places to make sure that we have procedures that talk about the how too. So we'll see what else. So you're anticipating posting soon, and is that a part-time position, Daryl? How many hours?
Full-time.
Oh, full-time, okay. And it'll be sorry?
Unless we don't find a candidate, then maybe we'll have to reevaluate how we are staffing the Board of Health. So, that's our goal, is to fill in would be the easiest path forward. And it's a very challenging role because it really is the central control point for everything moving through the Board of Health, and lots to keep track of. And as we all know, regulatory compliance is key. Deadlines and coverage of documents and all the rest. So I think it's an interesting, challenging spot to be in. It's not simplistic by any sense.
Right.
But I'm just not sure what we'll find. So.
Yeah, well, I mean, it's an interesting time to post out, and yeah, I mean, I think it will be interested to hear. And if I can be helpful in any way, if there's something we can do under shared services to support y'all, very happy to do so. Okay, Brenda.
Yeah, thank you.
Brenda, did you have a question? Oh, looks like she's on the phone. Nope.
I wrote in the chat, a question, and it's not, who we have is wonderful. And when you have like one inspector in these modalities, should you send someone else to some of these trainings? So at least someone else knows how to do it?
So that's a kind of a two-parter. It's a policy question for the community, right? Of how
Right.
how will they staff and build in redundancy? But I'd say as well that as part of the shared services arrangement, there's a regional health inspector that we hired, Thalia Stempeladou Rocha, who is out sick today, which is why she's not on the meeting. But Thalia is a resource for all communities, so that, and that's you know, if there's extra work, if there's a food festival happening in town and you need more than, you know, a lot of hands to do food trucks, or as you say, if someone gets sick or is out on vacation. So so there are resources. And again, I think it's a policy question for each community to consider um the value or the merit of having other folks trained. But thanks to shared services, you are never alone. You have me, although I can't do a food inspection yet, but you have Sam who can, and you have Belia who can. And amongst us, you know, if we can't do the thing you need, we're really good problem solvers, and that's our job, is to figure out how, you know, what's the problem and how can we get access to the things that will solve it.
In the trainings, do they have one specific for like camps? Because that's something that goes between the health inspector and the nurse, and it goes back and forth who should be doing it.
So camps is one of the curriculum that is being developed. Last I heard, that camp curriculum will be available probably in the fall. So it's status quo for now, and then there will be a training that'll be available. And again, I think then it goes back to the policy question for the community of how many people do you need to do camp inspections? How many camps do you have? And, you know, we will be looking to have regional resources that could support that too. Sorry, there was one other thing that made me think of that has slipped my mind. It'll come back. So yes, I mean, the state standpoint is they're going to offer the trainings, I think once a month is kind of the cycle right now. The training currently is 3 half-day virtual sessions. I don't know if that is going to change as BU School of Public Health gets their contract moving. But right now that's the way it is. And then once you've completed the 25, well, somewhere between 25 and 40 hours of co-requisites that go with those, the food inspection trainings, and then you completed the classroom training, then the inspectors are eligible for field training, and they go out in the field, and that's where Sam and Rebecca come in. They will take inspectors out in the field, and currently the guidance from the state is that they need to do 3, each inspector would need to do 3 to 5 field training experiences. So out inspecting a restaurant. So we're waiting for the state to be able to certify Sam and Rebecca as field trainers. Once they're certified, they're ready then to field train other folks. So, and I think part of the reason they say 3 to 5 is that, you know, there's going to be a range of folks that you're working with. There'll be people like Jason who, you know, has been doing this, right? And Jason is probably not going to require as much, or someone like Jason would not necessarily require, he wouldn't require 5, right? And there are going to be some criteria, and there are some, you know, some things to be looking for. So there is some flex in that, and there is recognition that everyone isn't going to progress in exactly the same way. I think the state has said, more than once, they're working to just improve folks and get folks all certified and knowing the same things. It's not intended to be a barrier. It's not intended, I think Sam Wong said, we're not trying to work anybody out of a job, which I was like, oh, good. But right, so that's how that training will work. I can, Sam and Rebecca and I, we can talk more about that. Answer questions from you all. I think as the trainings become real, probably more questions will come up. I know I've heard from some places it's a big time demand. They're concerned about needing, having staff time to complete those 25 to 40 hours of co-requisites. And the classroom time, it's challenging when you have a small department and somebody's kind of running everything. So that's part of what we'll do with the training hub, is be thinking about what creative things can we do to help folks achieve that. Do we offer study sessions? Do we schedule things differently to accommodate what we know the needs are in our group of communities? That's it. Sorry, I could talk forever about the training stuff, so I gotta just stop. I'm passionate.
Would shared services pay for that?
Say again?
Would this shared service grant pay for the training?
So they're free. They're
Oh,
free,
okay.
right? There's no cost for them. It's part of the state's, saying we're requiring you to do this, and we will provide you this. The central trainers and our central trainers are state employees. They've secured services from BU School of Public Health for curriculum development and organization, but it's a offering from the state. You don't have to pay. So. Okay. Have I exhausted that topic? I think I have. So then next thing would be Dover and the Dover public health nurse. I know Jason and I have messaged a little bit. As I know Jason's been working with Sam and Thalia to get Thalia in doing some inspections there. But I don't know, can y'all update us on how where you are with your public health nurse?
Yeah, so basically where we're at as of this moment is our personnel board has to formally approve of the job description. It was supposed to happen at the January meeting, but for unknown reasons, it was kicked to the February meeting. So that, I believe, is sometime next week. So we're kind of just waiting on that. And then, I mean, from there, we should be able to post it finally.
Yep.
And right now, Kay and I are working with, I believe it's Tiffany, to see if we can
Yes.
kind of set up, like a training type thing to, to get the new nurse acclimated with everything and get her up and running. So that's kind of where we're at right now. So just waiting on that meeting, and then from there, kind of all systems go.
Okay.
So, Carrie,
And then, sorry.
meeting, Daryl, Jason and I are meeting with Tiffany very soon. I can't remember what day, but
Great. And we have questions, interview questions from when we did the interviews for Kelly that were devised with Tiff and Brenda and others that will share, and you can use them or not. You can amplify any of them. Happy to support that. And I know when you guys will run your interview process as you will. But however we can be helpful on that, again, please ask. I'd rather have you ask and have to say no than have it not, although I try not to, but.
well, we appreciate all the support. I think this is great. And we'll be hearing from Tiffany about, I can't call her Tiff, I've never met her, but
It's
right.
okay.
From Tiffany about the onboarding process that that you offer.
And I think too, one of the things that I have talked with Kelly about, one of the things, as Kelly, because she's going just through this onboarding a little bit earlier, and it's, what does it mean to establish a public health nursing presence in a community? And Kelly's gonna go shadow Brenda Healy. Thank you, Brenda, for offering to host as well, so that she can have that perspective as well. And when you all are staffed, I think, the question will be, how can Kelly work with and support that person? What I have asked Kelly to do is create kind of a two things. One is kind of a checklist of what does it take to start up as a public health nurse. So Kelly just is the creator. She's going to draw on the knowledge from Brenda and from Tiffany and from Ginny and others. The intent is it'll be a tool for communities as well as for nurses as they roll into a new setting. And then the other piece is something to, I don't know, we're talking about maybe a flyer. I'm not sure what the format is yet. Kind of a list of those services, and it comes out of the job description that you have. And one of the things we've talked about, Brenda, I know you offer blood pressure clinics in
I do.
Medfield, and
I do.
Kelly's gonna join you for some of those. And we talked about whether that might be something that Dover and or Sherburne would be interested in having Kelly do when she's ready. She's not quite, we haven't cleared her quite yet, but that as kind of a indicator of what these new nursing services will be, Kelly could come and offer a blood pressure clinic, or answer questions in Dover and Sherborne, and just kind of be that presence ahead. So I put that little bug in your ear as something to think about. Brenda, do you have a question?
Yeah, I also think, and this group would be perfect, it wouldn't really be, that the 5 of us nurses, well, there's more than 5, got together maybe once a month and just kept each other up to date. So for Kaylee's not getting pulled this way, that way, like I'm gonna have a vaccine clinic on the 3rd. Well, no, I'm having one on the 3rd. I think it would be important, and it would be important for this new hire to know that support will be there. That's
Yeah.
all.
I mean, I love the idea, if of there being kind of a nursing check-in, so that y'all have a calendar together. I think, if the other communities are open to that, I think that's a great practice. And, as you say, you're not working against each other, you're not scheduling on competing times, and, as possible, you can support each other, so. Okay. Oh, and I see, sorry, I'm just looking, I see our guest, perfect timing. Diane Legere from Relevant Systems has just joined. And so, I don't know, are there other questions before I move to Diane? I think she is gonna have about, well, we talked about half hour to 45 minutes to make sure we allow for questions. So I am gonna introduce Diane and turn it over. So Diane, representing Relevant Systems, I know you've worked with Sam, and I know with folks in Needham, probably with Jason too, maybe already, on Food Code Pro and how to use it. So this is our Charles River Health District Advisory Board meeting. We have board members from each community present. All of our voting members are members of the Board of Health. And so our 4 towns, it's Dover, Medfield, Needham, and Sherburne. And then we also have some staff, and there are fewer staff. So we have Rebecca Queenie is a regional trainer. So she's part of the training hub that serves Charles River Health District. Brenda Healy is the public health nurse in Medfield. Tim McDonald is the health director in Needham. Jeremy Marset is the town manager in Sherburne. Jason Belmonte is the health director in Dover. And Kelly Boudreau is a regional public health nurse that serves this group of communities through the contact tracing and case investigation funds. So that's staff. And then we have Ed Cosgrove, who's Board of Health in Needham. We have Kathleen Thompson, who is Board of Health in Medfield. Carol Reed, Board of Health in Medfield. Kay Peterson, Board of Health in Dover. And I'm gonna, let's see, you're a panelist. I'm gonna make sure you're promoted in all ways so that you can share your screen, and I'm gonna turn things over to you. You're muted, Diane. Yeah, that happens. Let's see.
Okay,
Bob-
good morning, everyone. Let's do that again. One thing we realized is that we never demonstrated how the affiliations work because Needham was already a long-standing existing client. So I just wanted to do a just real quick review of how that works first. Give me 1 second.
Are you getting a message that I promoted you in every way I could, Diane?
No, I know, and it's not letting me
Hold on.
share.
You are a co-host. Oh, dear. Technology. Facing. A co-host. Huh.
I'm just getting a blank screen with no options to share. I'm not getting a message that I'm not allowed. I'm just getting, you know how typically when you share a screen, you'll get the desktop and whatever files. There's nothing there. It's not letting me.
Huh.
Maybe I'll close and try again.
Okay.
Yeah, it's not letting me share anything.
Oh. I am looking at all of my. She's a co-host. Does she not need to be a guest? Ooh. This is tax report. Yeah, so I don't see it is tax.
Maybe you could email it. And then Kelly could share.
But I have to be able to share my screen to do the demonstration
Try again.
because I actually, how it
Dan,
works.
can you try again? Still no.
I'm getting nothing. I'm getting a blank, it's just a completely blank page when I go to, and Zoom is what I use. I've never seen this before.
I know, so,
I apologize. I've never seen this. I use Zoom every day. So I don't think it's a permissions. It's just not allowing me to share anything.
Carrie, I
yeah,
just clicked share screen on my desktop here, and it's allowed, it looks like it would allow me to share a screen. So I wonder if Diane should just close and come back into the meeting and see if that works.
Yeah, let me log out and right back in. That would be great.
Okay.
I'll do that real quick. Thank you.
Yeah, thanks,
I'll be
Diane.
right-
Thank you, Kay. Yeah, because the share permissions are set for multiple to share. I'm just looking to see if there's advanced. You
And
know,
would other people be able to share their screens? I have that button right there and my whole
yeah,
desktop pops up when I click it.
Same.
yeah, it's a funny thing because it's,
Okay, let's see if this works this time.
whoops, Carol, you're sharing.
Just trying it.
Yeah, that's good. Yeah, no, it works and it's set for you to, for multiple to share. I'm a little baffled.
It says screen sharing has failed to start. Please try again later. Is what I'm getting. And then
All right.
it goes to that blank screen again. I'll take a picture.
So, all right, well, at least we got that message now. It's not blank. So can you try one more time, Diane? I just switched it to one person can share at a time and
Okay.
maybe it's confused, so.
Okay, let me just X out of this. Here we go. Nope, I'm getting that same blank.
Oh,
screen.
how frustrating.
So what we can do is I can give you an overview of what we do. And then I'd be very happy to, and I can answer questions. We'll kind of go backwards. So I'll answer questions. I'll give you an overview of how we work. And then I'll back it up. As soon as we're done, I'll create a quick Zoom video for you as a demo. And I'll email it to everyone so you can see how it actually works in the field. Would that be, I don't want to waste your time if it's not working, but I want you to get any questions that you might have answered. And I do want to demonstrate how the program works both in the field and in the office.
Thank you, Diane.
Does that sound like a reasonable solution? Okay, great. So first of all, I'm really excited to meet all of you. I'm very familiar with the team in Needham, but I haven't had the opportunity to meet some of our newer members. So welcome. And how this works is we've set you up as a PHE group. And what we've done and what makes us unique is that each town within the PHE maintains their level of independence. However, you have that ability to share your regional inspectors. And I know Thalia's a regional inspector and Sam's been helping out with the regional inspections as well. So they have access to do inspection in every town, but the town still stays separated. For example, Needham can't go into Dover's account, and Dover can't look at Needham's. They're still independent licenses, and every town has the ability to customize their account. You can set up scoring if you'd like. We have customized scoring. You can set up permissions if you'd like for each town. And if that's something that you want more information on customizing your town to meet your specific needs, I'm happy to meet with anybody about that and walk you through the customization process. And as part of your subscription, here's what you get. You get me, you get our customer support team. For any of you that have been in public health a while, I'm sure you're familiar with my colleague, Paul Halfman. He leads up our housing, and we both cover pools and Relevant 360. You get 24-hour technical support. We handle your onboarding, and that includes training sessions. We also offer not just your initial training session, but we offer ongoing training. So you can learn about new customizations so that you can get refined training the more you use the system. And those are scheduled, we schedule a quarter at a time. So we're scheduled through the end of March right now. And those are drop-in training sessions that anyone can join. And we also automatically update the code. For example, the housing code changed last year. when the housing code change went live, so did we with the new code. It's automatic. For anybody that's involved, I know Needham's part of the FDA retail program standards. You're required to stay on at least two of the most, you can only go back 8 years of food code, basically. You have to be on one of the two last releases of the FDA food code. And what we're finding in Massachusetts is 2013 is the mass standard. However, a lot of boards adopt the most recent version of the code by reference. So we run all versions of the food code. As soon as a new version is released, we can update your account with that. And we also provide training for your staff on any changes from the code that you're on to the most recent code. So that's what's included. Any questions about that? How the regional group works? And I wish you could be looking at my diagrams as I was talking. It's not as helpful. Any questions about the software?
I'll just mention that the regional application is helpful. We just use a food inspector who's employed full-time in Boston, and so liked using the software there and now can use it in our town. So
Excellent. And I think that's really the key is being able to regionalize and having your inspectors go from town to town, use the same platform. All of your data is going to look the same. All your inspection reports are going to look the same. It really creates that consistency throughout your regional program, which is really, really key. Oh, actually, I can forward the slides. Or oh, you're muted.
Sorry, I thought you were just going right into the system and doing the live demo. I didn't realize you had some slides too. I can share your slides. I just can't do the live demo.
I'll just send them. I'll send everyone a package when we're done. I'll send you all an overview. It's just 3 slides. It was just to give you an idea of how we set up your regional group and what's included in it and what services we provide in addition to the software itself. One of the great key things, and Carrie's really familiar with this, is we're really customized, and it allows you as a group and as individual towns to customize to meet your specific needs. And it also creates that consistency in reporting. We have a lot of really neat features that I will go over in a quick demo for each of you. We can create customized notes that are automatically linked to an inspection, because especially in food, we document the same violations over and over. Out of the 600 and something, and it depends because we've got mass regs, we can add local regs. That's something to keep in mind, is that each town, if you have local ordinances, we can include them in your version of Food Code Pro. So every town may have a different number of violations based on what their local regulations are and if we've incorporated them. But out of the 600 plus violations, we tend to document about the same 50 to 60. So instead of writing the same notes over and over, for example, thermometers, the thermometers must be located in the warmest location in every refrigeration unit. Instead of your inspector typing that every time they document that particular violation, it's push one button. And the beauty of that too is now your inspectors are all documenting the violation the same way. So it creates that really consistent reporting. It's a really great tool that I've been working with Carrie and Sam and Needham on for quite a while now. Cy from Needham's been involved in the process too. And I think that's a great feature, and it's a great time saver. Using the software, it creates better inspections. It creates much more comprehensive inspections. And it saves time. You're gonna save about 20 to 30% of the time in the inspection and get a better inspection. If you're not familiar, I can also send a sample inspection. I'm a huge advocate of educating the public as well. And what I love about our inspection reports is anybody that looks at this end product can understand it. It doesn't matter if it's the person in charge, the restaurant owner, or it's a customer who's asked a copy of the inspection report. It's very clear. You can read the note, and then it actually writes out the entire section of FDA code. And then there's the pictures. The pictures tell the story. Any questions?
Diane, I know that Relevant is offering a kind of, I don't know if you've moved it to weekly at this point, an intro once communities data is uploaded and the
Mhm.
iPads are set up. Is that something that non-inspectors could attend? Would it be
Absolutely.
useful for them? Yeah, okay.
Absolutely. And that's something I will send. I'll include that. I'll include the Q1 training schedule, because I think it's really handy to know exactly how the system works.
Mhm.
And like I said, we offer those initial trainings the drop-ins for new users, but then we also, for inspectors that have been using our platform for a while, they maybe are not aware of certain features. I run into that constantly because we're constantly trying to evolve based on the feedback that we get from our users. So we're always making little improvements to try to make the inspector's job easier. I come from public health as well. So I look at everything from the inspector's eyes, and it's my job to get that feedback constantly and make our system better and more user friendly. And
That's
those are
great.
short. The refreshers are much shorter. They're half the time.
Yeah, just in case folks are curious, it's a way to see exactly what their inspectors are learning too. So great, thanks.
Anyone have any questions about the system or another thing that I should point out too is anything that we put into the system can be pulled out of the system. So data, we're always looking for data. I used this when I was actually in the field as a health agent, and I used to present monthly reports to my board. This is what we've done this month. These were the schools that were inspected, hospitals that were inspected. This is how they did. And that data just comes from running quick reports within the system. So I always tell people anything we put in, we can pull out. It's a great way to know exactly what's happening in your town. I also do a lot with the FDA retail standards, and I have been able to do a lot of risk factor studies. So that's something that you can really dig down into how your town is doing and identify what the specific risks are within your community. Do you have problems with hand washing? Do you have problems with hot or cold holding violations? So you can get very specific as to what's happening within your community just by running some reports. And then you can really focus your educational outreach based on the needs of your community.
I love that root cause analysis piece, because now it's not just here's what happened, but it's the how do we, correct globally. I think that's a great capability. And I know I don't want to cut your show, but I know, so this is Food Code Pro, but it's also there's the housing capability that once the housing training is up and running, then that will also be used. And we actually have licenses for housing right now. It's usable now. It's just that the new curriculum hasn't been released, but same thing, housing is available and you get the standard questions and everybody answers kind of in the same way, right? Is that it's set up in very similar
It's
fashion.
very similar. And the great thing about housing is my colleague, Paul Halfman, he's the greatest. He's actually been contracted by the state to teach the Mass Fit for housing. So you have the best of the best as your support. And he's also available, both of us are available anytime for questions. I get questions about the code constantly. That's a resource that is included in your
Part
subscription.
of our package,
I-
yeah.
I see Daryl has a question.
So, thank you. And I know that we pitched the complicated topic of local food trucks to you before, and I just wanted to say if you ever have any questions about what data were we hoping to be able to have more automatically loaded, and or how did we want to use that, certainly let us know, and we could fill you in on that if it helps.
Yeah, there's a, Diane, that's the reference to, there's, I know you've heard this in other parts of the state as well. There's been queries about, these food trucks go all over the state and they're the same people, and can't we just access the common list? And I know that that's not the way Relevant is set up. That's not something that we're doing quite well. I don't even want to say quite yet, because I don't know what Relevant's plans are, but it came up with us as well. So that's what Diane's referencing, is kind of the how could it be done, and
To
you know
share the
why.
data
Yeah.
with the food trucks. That is something I've actually been working on, and that will be part of our version. We've been in the process for the last year. We're working on version 2.0 of our platform. About a year out from release. It's a really heavy lift to do a whole new version. But that is something that we're working on. Another thing, you know, how I talked about creating consistency. One of my clients is the town of Charlton. And if you guys are familiar with Treehouse Brewing, it's a really popular brewing destination, and they have food trucks every day of the week. So they're doing food truck inspections every day of the week. So what they needed, what their ask from me was, how can we simplify this? How can we make it quicker, consistent? So we actually created a linked spreadsheet for them. It's a linked inspection. So it's still a very comprehensive inspection, but it's dedicated to food trucks. You can get in, get out, do a very comprehensive food truck specific inspection, 10 minutes. And because of the popularity of that specific checklist, it's now being used in 38 towns throughout the state.
Oh.
So now, because food trucks, one of the big challenges for food trucks and caterers is they have a different set of rules. It doesn't matter from town to town, because each town may do things a little differently. And one of my big dreams is to create more consistency with local boards of health. And so we've been really happy with the success of the food truck inspection, because it is creating consistency. And the more people that use it, the more that food trucks know, you know, what they're going to expect when they apply for that temporary permit, or maybe an annual permit. Town to town. And that data, obviously, I do have access to.
Actually, that alone, the education for local food trucks, that what's expected of them, because a lot of them spent a great deal of time fighting about having to give us any documentation, because they say no one else asked for it.
Mm-hmm.
Which I doubt is the case, or maybe they're falling through the cracks or something. So
Well,
yes, consistency would really help us out a lot.
it's the biggest challenge. I deal with, I mean, every town has a different set of rules, and some towns you really don't need much of anything. And then other towns maybe are exceeding the requirements. So it is a very difficult challenge. And you know, I am as hopeful as you are that we get more consistency throughout the state. Because I used to inspect a couple commissaries, and so I still get a lot of questions from food truck owners, you know, and I go by the code.
Very simple.
Yeah.
Yeah, I think, it's really nice to have this tool. I think it's a great thing that the group has purchased because it supports that consistency in training. And it also supports the flexible access because our regional inspectors, so Sam and Lilia right now, have access. They can do an inspection for each of the communities, and that it's so that mechanical piece, which should be simple, but isn't necessarily. That mechanical piece is taken care of by being here in the system. And then that means too that, if the advisory board wanted, we could ask about doing some analysis across the 4 communities. It doesn't have to simply be the individual community. And we'd be happy to entertain that. But there's a lot of capabilities that this system gives us. And I didn't have the pleasure of working with Diane in any of my previous lives, but I did get to work with Paul Hoffman. And I know Diane is, equal to Paul, and we developed a training. There was a housing code training that we developed at LPHI just before the code change, the new code was adopted. And I just, Paul is outstanding. He really understands the practical local needs and understands the code. And the knowledge that he and Diane and the other folks bring to developing this product it's exciting. I'm a little geeky to say that maybe, but it's exciting. So, yeah. So I am sorry that we couldn't see the
I'm
live
so
demo. I thought that would be the greatest. And I'm completely puzzled that we have found something on Zoom again that doesn't.
And this
Or-
is what I use to conduct trainings. I use this every day. So
I know.
but what I am going to do is I'm actually going to do the Zoom clip for you. So, and I'll email everything to Carrie. I'll send you those few slides. I can also send an example of what a food truck inspection looks like that's linked. That's one thing I wanted to point out. The great thing about the food truck inspection is because you want to get in and out, there's small spaces. We actually link each violation to the correct section of code. So you're not even having to look up code. It's all done for you. You're in and out. You're using the correct code. So it's just a helpful way to create a great inspection.
Really good, really well thought out. So,
Piece that we would be curious about is just the checking that they have gone through the proper permitting within the community that they originate from. And that would be a big time saver too. I don't know if that's possible, or we really just need to do that due diligence independently anyway. I'm not sure.
I work with the state of Connecticut, and they just adopted statewide. It's incredible. A joint program that if you are for mobile vendors and for caterers, that if you're licensed in one town, you're licensed in all. And Massachusetts needs to follow suit and do that as well. One thing specific to food trucks that a lot of people don't think about, and it's just something past experience that I do like to share, is that obviously food trucks need to be working with the commissary to get their permit. Doesn't matter what town they're in. Having worked with a couple commissaries in the past, what I have found, and I encourage people to do due diligence here, is just because they are associated with a commissary doesn't mean they're using it. So I really encourage towns to actually reach out to the commissaries and see how regularly they're being used. It's cause for alarm, the amount that happens. So I just like to share that since we're on topic.
Yeah, that does sound a little alarming. Right, well, are there any questions about this relevant system, about Food Code Pro, about housing?
I mean, and
before-
if you would like, I can have Paul do a quick demo of housing. He could do a quick recording if that would be helpful, so everyone can see
Oh,
how the two different programs work.
that would be
I'm
great,
happy to do
Diane.
that. We can do like 2 15-minute Zooms for you, clips, and then
That's
you
great.
get a look at both. We'll definitely do that.
Yeah, I definitely see lots of nodding heads in the
Okay,
group.
great.
So good, thank you. And I think, yeah, I'll just say, I mean, this is, you can see that the Diane is representative of the service, the engagement that we have with Relevant. So it's really, it's awfully nice to have a vendor who's such a good and active partner, and, you know, is flexible and willing to kind of engage in what the questions are within reason. And they know the code, so they're not, you know, just making the expedient business solution. They're doing so with knowledge of the code, and, you know, so not getting us in a position where they might say, oh yeah, we can do that, but it turns out that that goes completely against code. So it's been a pleasure to get to work with Relevant to date. So
Yeah, an absolute pleasure working with your group, and I hope to get to know the member towns as well. I've been working with Needham for a while, and I know Thalia, your regional inspector, very well. You have a great regional inspector, and I've been working with Sam. She's absolutely lovely and bright and talented. You have a really great group, and it's a pleasure on our side working with you.
thank you for saying that. That's nice. We feel like we've worked hard to make it this way, and we feel like it's a good team. So, okay, well, since there aren't other questions, I guess we can say thank you. And Diane, so I'll look for that email from you, and I will forward that out to our group as you know, when they get it, and then we can invite you back if there are questions at another time.
Absolutely, anytime. Absolutely.
Awesome, great.
Okay.
Thank you so much,
Nice to
Diane.
meet you all. Take care.
Thank you.
Okay, so that brings us to the end of our not official, well, except for scheduling. So our next meeting is the 15th, February 15th at 9 a.m. That's our regular Thursday morning, 9 a.m. time. And Kristen and I are working on getting getting the authorization for alternate posting done, and we have a schedule for getting posting done. So hopefully, I think we'll add it in a little earlier. We'll get it squared, but so we'll be posted for the 15th. And at that meeting, I'll have updates about well, any update I can get on medical director, fee review, and the IMA. Those would be my things. Are there other things that folks would like to see on the agenda? Other ways that you want to spend your time? Not right now. Okay. Okay. All right, then. I guess I get to give people 15 minutes back unless you want to stay and talk about something else. Okay. All right. Thank you all for your time. Thank you for the chance to work with you. And I will see you in a couple of weeks.
Thank you.
Thank you very much. Good to see you all.